At Providence Mission Hospital's emergency room in Orange County, California, the Omicron variant brought a record number of patients, putting a strain on hospital staff that have already taken a beating. Despite the onslaught, trauma nurse Amy Langdale says she still gets asked if COVID is real.
I don't think the public understands necessarily what we're still seeing and dealing with. And, we were heroes for a month. And we didn't like being heroes because we're not heroes, we're doing our job.
Orange County has one of the highest COVID-19 hospitalization rates in the state, where cases peaked about 2 weeks ago. Fewer intensive care beds are needed for this less deadly but highly contagious variant, but doctors say it is still inflicting major lung damage on the unvaccinated. Depleted by sickness and resignations, many staff members say they have caught COVID twice, have had little time to process hundreds of coronavirus deaths, and face tense moments with patients and families in a county known for its conservative bent, according to about a dozen doctors and nurses who spoke to Reuters.
The past 2 years has been the worst 2 years of a lot of our lives, and there's been a lot of laughter, but I think there's just an underlying kind of depression.
The flood of cases has left emergency room patients waiting on gurneys in hospital corridors. Around 80% of patients on ventilators in intensive care are unvaccinated, according to a critical care specialist at Providence Mission. As cases fall nationally, deaths, which lag behind, have been rising, averaging over 2,500 a day. ICU nurse Danielle Shaw says everyone is burnt out.
Some have even stepped away from hospital nursing, some have switched departments completely.
But with patients still suffering, she says they'll keep their heads down and just keep working.
One of the things we learn again is that the virus has a way of bringing you back to earth. And I don't think, as we went into the summer, I think we were too optimistic perhaps. And we could have communicated more clearly about the risks and challenges that we still faced. And I think in raising those expectations about the summer, that we heightened the great sense of disappointment that people felt. The fact that far worse outcomes have been experienced overseas, which we know, well, that gives some important perspective, but it doesn't soften the blow. And it's fair enough that this disappointment leads you to ask, couldn't you have done more? Couldn't this have been avoided? After all, aren't you responsible? I get that. For me as Prime Minister, accepting this responsibility means asking yourself and challenging yourself every single day with those same questions. And I can assure you I do. I haven't got everything right. And I'll take my fair share of the criticism and the blame. It goes with the job.
Until now, our country has expressed serious concerns over matters such as the human rights situation concerning Xinjiang's Uyghurs at Japan-US summit meetings, G7 meetings, and others. We have been working to cooperate with countries that share the same values as our country. On basis of the purpose of the resolution which was just passed, the government will continue to work steadily in close cooperation with the international community.
We're not trying to cancel Joe Rogan. We are not trying to have him stop making podcasts. And it's this private company, Spotify, so they can do what they want. I'm just my job as an epidemiologist is to find risk factors for disease, and misinformation about the pandemic, about COVID-19 and about the vaccines has been a risk factor for more disease and death throughout this entire pandemic. And when it's spreading on a big platform like that, unchecked, it does create a sense of false balance and people don't know what to believe. So they'll believe the misinformation instead of the public health guidances. So the content advisory that they're putting on all COVID-19 information, not just problematic COVID-19 misinformation, it's really kind of inaction disguised to look like action. It's more spectacle than substance. So if anything that talks about COVID-19 can have an advisory on it, whether it's from the WHO or from Joe Rogan, it really doesn't accomplish anything.
Chicago blues drummer and vocalist Sam Lay, who performed with the likes of Bob Dylan, Muddy Waters, and Howlin' Wolf, has died at the age of 86. Lay died of natural causes in a nursing facility near his Chicago home on Saturday, according to independent blues label Alligator Records on Monday. Corky Spiegel, Lay's bandmate and longtime friend, told Reuters what made the drummer so special.
We played with all the great blues drummers. They're great. But Sam did something that other players that played with him can attest to. He just made people will never get to experience that.
Chicago blues developed in the Illinois city into an urban style from earlier idioms such as Delta blues. Alligator Records said Lay was known for his, quote, trademark, hard-to-copy double shuffle drumming, based on double-time hand-clapping in his childhood church. Lay backed up Dylan on drums at the 1965 Newport Folk Festival, when the singer-songwriter played an electric guitar and shifted to a rock sound, a pivotal event in folk rock. After Lay was honored for his music in 2002, Alligator Records said Dylan sent him a telegram in which he wrote Lay was second to none.
And Bob Dylan's like totally disinterested in anything. He's just not interested in things. He's just sitting there. You bring up Sam Lay's name, Bob will jump out of his chair and get excited. That's Bob loved Sam in that way.
Lay was inducted into the Rock and Roll Hall of Fame in 2015 as part of the Paul Butterfield Blues Band. He is survived by his daughter Debbie, 4 grandchildren, and 3 great-grandchildren.